Welcome to the Toothpicks at Health Talk show with me, your host, Faith Zvorufura. And today we're going to be talking about teeth, and we have a special guest, Dr. T. Manyanga. Dr. T. Manyanga, welcome to our Health Talk show.
Hello, Faith. How are you?
I'm fine, thank you. How are you?
I'm good.
Yes, it's
grateful to be here.
We're happy to have you here to talk about teeth. Inform us. You know, like most people really they sideline teeth. They don't like to talk about teeth, and they don't take like much importance about them. So thank you for coming today so we can talk about them. So to start with, please tell us about yourself. Who is Dr. T. Manyanga?
All right. My name is Dr. Manyanga, and I'm a practicing dentist here in Harare. I'm with the City of Harare at the moment, City Health Department. I've been with them for 2 years, but in general, I've been practicing for 5 years.
Oh, okay. So you just answered like the questions I was about to ask. Is like, how long have you been working? So let's just get straight into it.
Right.
Why is it important to brush our teeth?
All right. So what happens is the body is one, right? The anatomy of the body, it all works together. So if you neglect one part of it, that means somehow there are going to be complications and implications from just neglecting one part, right? So from just the social aspect of if you don't brush your teeth, you come into a crowd and you say hello and everyone just walks away from you. It's really important.
Oh, everyone just frowns.
Yeah, so it's part of who we are in our anatomy. So it's really important to take care of that as much as we take care of everything else, our hearts, our skin, and, our hair.
Okay, so how should one brush their teeth? Like one would just think it's just going up and down with a toothbrush, but I'm sure there's a technique, should I say, a way that it's supposed to be done, the right way of doing it.
All right, okay. So generally as dentists, we have a way which we encourage. We're saying you should have your toothbrush at 45-degree angle, and then you should brush in circular motion.
Okay.
Yes, it's circular motions, on all the sides, all surfaces of your teeth. The inside, the bottom and upper. Also, the palate, which is the hard part where you can put your tongue up there. You should brush it as well.
Oh, the hard part.
Yes, and then you should also brush your tongue as part of the process of brushing. So in general, you should take 2 minutes or more just brushing. Not too hard, not too aggressive, but, 2 minutes or more. But if you try and calculate the times, like when you're brushing, the amount of time it takes you, you see it's a minute or less with adults. Okay. A minute or less. But if you try timing it now to 2 minutes, it does the effective work.
Okay, so how many times a day should one brush their teeth? And why?
All right, as dentists, we encourage that you brush your teeth twice a day. In the morning after breakfast and in the evening right before bed. Why? Brushing is a mechanical process of removing the food that remains from our mouths, right? So if you do it right in the morning, just after waking up, before you talk to people, we assume is right. What happens after breakfast? You spend the whole day with food stuck in your mouth. And then we're saying when food gets stuck in your mouth, something's going to happen to it, right? Which we'll get into, I'm sure, later on in your questions. So twice daily, morning and evening. Morning right after breakfast, and then evening right before bed. After we're done with all the eating, no midnight snacks involved in that.
Okay, so my next question. Most people don't do this. Like visiting a dentist, people don't think it's important. Like, okay, personally, it's been a while. Because I don't feel it's important. So
that's disappointing.
Why is it important to visit a dentist, and how often should one visit a dentist?
All right, we're saying you should come twice a year. Every 6 months, you should come in for a checkup. That's when we see, are your teeth okay? Do you need any fillings? Do you have any cavities? And then that's when you get your cleaning, your professional cleaning from your dentist, which is really important because as much as you're doing the hard work with your toothbrush at home, we might need to do it too, just to be sure.
Professionally.
Yes, so you need to come in twice, you get your checkup done, and then preventative measures are taken before you actually have a problem.
Okay, so now coming to our next problem, tooth decay. Like most people even begin like having tooth decay when they are very young. Like how can one prevent, or before we go to prevention, what causes tooth decay?
All right, so as we said, we eat our sugary stuff, our starchy stuff, right? In our mouth, we have a film, right? That's in there of bacteria that just lives there anyway. So now what happens with this bacteria and the starchy things that we leave in our mouths without brushing, combined, they break down the sugars that are in our mouths from our diet into acids. The acid will start to attack your teeth. Yeah, so the first layer that's covering your tooth is called an enamel. Once that's broken down from the acids that are now in your mouth and forming all the time, you now have either sensitivity or you have an actual cavity because now your tooth is being eaten away. So that's the starting of the process of tooth decay.
Okay, so are there like certain foods one needs to prevent? Or to avoid eating? I think that's the right way of saying, to avoid eating, to avoid tooth decay.
Well, I don't want to be hated by a lot of people because now we insist upon a good oral hygiene, right? So even if you were to snack away on sugary stuff, if you brush and you have a good regimen of oral hygiene, your chances of tooth decay are much, much, much less. But than a person who's on a healthy diet but they're not brushing, right? So we insist on a good diet, a healthy diet, which is good for the rest of the body. Less fizzy drinks, less caffeinated drinks, less coffee, less, reduce the sugars that we're taking in our diet. This is good for the teeth. This is good for the rest of the body.
Okay. So now coming to our problem, like most people experience, the toothbrush. Some people can keep a toothbrush for a year or two and stuff. When is one supposed to change their toothbrush, or how often should one change their toothbrush and why?
All right. As we say, toothbrushing, right? It's a mechanical process of actually removing food from your mouth, right? The mechanical part, that's the toothbrush. And then we are saying you're supposed to aid that with a fluoride-based toothpaste, right? So many brands out there, but fluoride-based. This is to fortify that enamel that we talked about, the top layer of the tooth, the fluoride. But the toothbrush itself does the hard work. So you can imagine if it does the hard work and then at some point it's now folding away or just finished, it's not really doing the mechanical work it's supposed to do. So it's ineffective.
Okay. And then now with brushing our teeth, the toothpaste, you see even in shops, they're like different prices for certain toothpaste. Is there like a difference?
Yes. There are a lot of commercial brands now. But then with your regular visits to your dentist, that's when you get to find out which one is good for your teeth, specifically just yours. But some are for sensitive teeth, some are for bleeding gums, some are for ordinary teeth with no problems. So it depends. You have to ask this question directly to the person you consult as your dentist when you go for your visit to say, which one of these or which one do you recommend for me? Okay. But then all in all, we're saying a fluoride-based toothpaste. There's a lot of craze out there with organic things that don't have fluoride in them because it's poisonous, whatnot. No. As dentists, we're recommending a fluoride-based toothpaste because the topical application anyways. Not that much fluoride. It's not poisonous.
The whiteness of their teeth. There's been like so many methods going on and stuff, but professionally, what can one do to maintain the whiteness of the teeth?
Okay, so what happens with our teeth, how they lose sometimes their shade of whiteness, it's our diet mostly, right? And our habits, our oral hygiene habits, right? So we're saying some days you didn't brush or in the evening you just came home and you're too tired and you slept, right? And then over time they changed color. If a person was to come in and they were complaining of a dark shade of teeth, my recommendation initially would be reduce caffeinated drinks, reduce fizzy drinks, cut down on coffee itself. Right? These are colored things and they're obvious. If they can stain your tongue, they can stain your teeth. That's how it works, right? If they can stain your tongue, they can stain your teeth, right? So if you reduce on this, already you've done part of the work. Then we have some commercial brands of toothpaste that are specific for whitening.
Whitening. Okay.
So there are some approved ones. Again, you'd have to ask a professional to recommend. But then some are big brands, and by now we trust them, to give us the right product. And they're out there. Teeth whitening toothpaste.
Okay, what about the natural methods? I've personally heard of mixing soda, bicarbonate of soda, and lemon juice and form a paste, and maybe use it once a week to whiten teeth. I've also heard of apple cider vinegar. Do those really work, or are they really recommended for us to use to whiten our teeth?
All right. So as a dentist, if I recommended such things, I'd be out of a job. But then, do they work? Yes.
Okay.
Are they good for you to do this at home all the time? No. The whole basis of this at-home methods, right, home remedies, it's that it's an acid that you're putting to your teeth to break down that enamel, and then, whiter. You get a shed whiter. But over time, and with aggressive use and wrong dilutions at home, you are bound to end up with sensitive teeth, because now you've opened them up. You've removed the protective layer, which wasn't sensitive before. So yes, maybe when used with the, prudence, maybe. Maybe we can say they do work. Do I recommend them? Not very much. I need my job.
Okay, so on tooth sensitivity. Can you please elaborate on it? What is tooth sensitivity?
Okay, so remember when we said the tooth structure itself. We have the first layer, which is the enamel, and then we have the second one, which is the dentin, right? Dentin, very sensitive, which is why God probably covered it with enamel, right? So what happens is either when your tooth is chipped, the dentin is exposed. When your gums, there's gum recession, when your roots are now showing, you've seen people with long teeth, over time, age, or from aggressive brushing, we end up with our roots exposed. They become sensitive as well. So, and also those aggressive ways we talked about of whitening with at-home remedies, all that can lead to sensitivity. What we just have is the enamel, which has been taken away from this tooth. Right. There are ways to try and solve this. We have either fluoride applications at the dentist, professionally done. And then we have, sometimes you just need a filling. But sensitivity could be coming from just a cavity. You have caries, dental caries. So you need to come in, and then the dentist is one who assess and diagnose where your sensitivity is coming from, and then suggest what was the right way to go from there.
Okay. So moving on to I personally haven't experienced it. I don't know whether I'm not growing or what. But apparently, from 21, you're supposed to have it. What is it about? What's the fuss about the wisdom tooth?
All right, so humans, we get third molars. We have 3 molars on each side of our jaw. So these third molars come out. They erupt between the age of 18 and 30. They take a long time. Right, but then the problem is they occupy the remaining space after you get all your other teeth, right? Because now you're an adult. In some people now, there's not enough space. So the tooth is trying to find space to come out from. So you may end up with pain from just the crowding, trying to crowd itself in the remaining space, or you have, it just partially comes out. We call this impacted teeth. Either way, you'd need them assessed at a very early stage, say 18, 21, as you're saying. You come in, and then your dentist will see if they're erupting right, and they should be left alone. If they are not, before it's a fully formed tooth, because it's not going to be of much use to you anyway if it's partially erupted. So they would need to be taken out, right? At an earlier stage, before you get much pain and, the tooth is not that grown, it's much easier to get them out then. So that's the story with wisdom teeth.
Okay, so I wanted to get braces. I still want to. Who is meant to get braces, and what are they supposed to do to your teeth?
All right, so braces are for aligning, let's call them crooked teeth, mal-aligned teeth, right? Sometimes you have one which is out of the way or just not sitting in its place, or you have that gap in between your teeth. and you want it closed. So it's just for alignment of teeth in the jaw, right? It's not a fashion statement. So you're supposed, the person who does this is called, it's a specialist, an orthodontist. So you're going to a general dentist every 6 months. They will refer you if there's need for you to get braces to the orthodontist, where you can get the braces, which last between 6 months to 3 years, sometimes, depending on the treatment that's happening. But it's mainly to align teeth back into their arc, so that, you know, it's aesthetic in some people. In some people, they can't actually bite their teeth well because they are crooked like that. So it's a necessity in other people. Some, it's just aesthetic. I need to close a gap. Simple as that. That's braces for you.
Okay, and flossing. What is flossing, and what are the benefits of flossing?
All right. So remember the oral hygiene routine. We said you need to brush your teeth twice daily. You're supposed to floss as well. Floss once a day. There's a tape. It's called either dental tape or dental floss, right? You can get this as 50 meters for a very, very cheap price, which is why people should invest in it. Floss, you're supposed to take a small piece of it and then clean in between. The job of the purpose of it is to clean in between our teeth, right? Because our toothbrush cannot get there. So sometimes you have people who brush right, who eat right, but then they have bad breath. The spaces in between our teeth are collecting food, and we're not flossing or cleaning those areas. So that's its importance.
Okay, so lastly, what are the best ways to practice good oral hygiene at home? And within that question, you can just give us maybe words of advice.
All right. So, good oral hygiene. Let's talk about that. So, oral hygiene, as we said, diet, it matters. Less sugary foods, less touchy foods, less caffeinated drinks, right? And then we're supposed to, as far as I'm concerned, I would suggest grouping our meals so that we're not chewing the entire day, because now the brushing of twice a day becomes inefficient or pretty much useless. So snacking on starchy and sticky snacks during the day, the entire day, makes the brushing useless. And then we have that film that we say dental plaque forms around this teeth. It's active all day long, right? So diet. Then we have brushing twice a day, and for 2 minutes or more, right? And then changing our toothbrush every 3 months, right? So that it's efficient and it works, right? Brushing with a fluoride-based toothpaste, right? We have flossing once a day, which we're saying in the evening, but then some people are comfortable doing it during the day or at a traffic light, everywhere, but we're saying it should be done at least once a day, right, in a business life. There's also sugar-free gum. You can use that, right? It's for fresh breath. It's good for you because it's sugar-free, so that's fine. And as a snack for people who can't help but chew all day.
Chew all time.
Yeah, so those are the things I would stand by. We also have mouthwashes for mouth rinses for those, eat at work and then want to floss from there. You can always use a fluoride-based mouthwash.
Okay.
Toothpicks. I discourage those, right? Toothpicks, I discourage those. We are saying floss. It cleans in between your teeth. Now what happens with toothpicks is we are forcing them in between those spaces. That way, it's some natural
alignment.
And then you're spacing them, even further, you're pushing your teeth further away. So the more you use a toothpick, the more you need it, right? And the bigger it has to be. So they start small, thinner, and then they grow. As you have more need for these, right? So toothpicks, not approved. Let's go with dental floss, right? And mouth rinses after eating, in case we have those bases already, and you feel it like a food packed somewhere. That's 1. 2, the other question was bad breath. So bad breath is also called halitosis, right? With bad breath, it can be a number of issues that could be causing this. 1, our diet, garlic, onions, all those other things that people eat. 2, the spaces in between. If we are not flossing, what's happening in between those gums, in between our teeth? all year long, right? That's 2. Number 3, we're not going for that professional visit to the dentist for a cleaning once in a while, because now we have dental plaque or dental calculus that's just stuck in our teeth, and the toothbrush is not doing its job anymore, right? And then some people have actual, stomach problems where they have reflux, right? Where, let's say they burp or something like that, right? It's a reflex where food comes back up, right? So if you have a gastro problem, you can have bad breath. If you're not flossing, you can have bad breath. So if it's a gastro problem, we have to refer you to your physician to go and get help with that problem. It will go away, because no matter how much cleaning you get at the dentist, you still have that bad breath. So you need the reflux problem fixed first. That's the second thing. And then we said the flossing, we've already talked about that. And then the diet, that can always be fixed, because when you go to your dentist, it can always tell you where the problem is coming from, and then you'd have to adjust as needed, right? So yes, those are the things that we have.
On how to do it. This was the Toothpicks Richard Health Talk Show with our dentist, Dr. T. Manyanga. Please do keep in touch and wait for our next show, where we'll be doing the practical lessons on brushing our teeth. And this is it from me, Faith.
These and other stories, visit our website www.263chat.com. Follow us on Twitter @263chat and like our Facebook page 263chat.